And are we supposed to like look into the camera? Is that how it works?
If you do look at the camera, it'd be this one.
Mhm.
Hello, BDO family, and thank you so much for joining us today. We are here at Charles Drew University speaking with some of the esteemed staff and faculty who will be discussing their role as BDU as well as some of their programs and special projects that they're currently working on. And they're going to share some insightful health information with all of you. So it is now my pleasure to introduce you to Dr. Cynthia Davis.
Thank you.
Of course, of course. So just to go ahead and dive in, Dr. Davis, can you tell us a little bit about your role here at Charles Drew University?
Okay, well, I've been at the university for 39 years. I was recruited back in the summer of 1984 to develop one of the first teen pregnancy prevention programs in South LA. And then I sort of segued into HIV and AIDS. So I primarily work in the College of Medicine. I co-direct their street medicine program for the since 2020, since the COVID pandemic. We've gotten a significant amount of funding to address the COVID pandemic and its impact in the African American and Latino community. So myself and Dr. Alexander Rogers and Dr. Jerry Abraham, we all co-direct this street medicine program that's been very successful in educating the community as well as immunizing at-risk individuals in our community. I also teach in our College of Science and Health in our Urban MPH program. I've been teaching in that program since 2008. And so I really enjoy what I do, developing community service programs. I'm involved in some research projects, and as well as now with the new medical school, a portion of the medical education program is going to be integrating in our street medicine program as a site where the medical students will go and do community outreach with us. So I'm really ecstatic about that, really happy about that.
Awesome, awesome. So I do know, I've read a little bit about your bio, about you, that you are an integral part of improving HIV/AIDS health outcomes in the Black community, especially here in California, or in Los Angeles, excuse me. So could you tell us a little bit about some of the projects that you're working on in that space?
Okay, well, again, over almost a 40-year period, I've been involved in HIV primary prevention. I was instrumental in starting the first HIV mobile testing program in LA County back in 1991 with funding from the Magic Johnson Foundation, Girls Welcome, and LA County Health Department. The program was so successful, LA County replicated it and purchased additional vans. And for almost a 20-year period, we were sole source funding to do mobile HIV testing, not only in South LA, but throughout LA County. Also instrumental in going into the schools with CDC evidence-based curriculum to educate at-risk youth about their risks for not only HIV, but other STIs, and developing peer advocate training programs where we train young people to actually educate their peers about HIV risk reduction. And I currently direct a county funded, it's called a social and sexual networking program since 2000, where instead of doing mobile outreach, we have like a freestanding facility where we partner with some agencies where we offer HIV rapid testing, the 1-minute finger prick test out in the community. So there's a site in South LA called Granada on Broadway, right in the heart of the community, where we go 3 days a week between 12 and 4. And we offer free HIV screening to at-risk populations, which include sex workers, unhoused individuals, adolescents, injection drug users. And then we also have a site in the Skid Row area of Los Angeles, downtown LA, where we partnered with one of the largest residential uh, uh, shelters in Los Angeles called SRO Housing. And in one of their residential hotels, we go and we offer HIV screening services. So, been very effective again in educating the community about their risks, letting them know that HIV is no longer a death sentence, and that once you know your status, you can seek immediate care and treatment. And for high risk negative people, to educate them about PrEP and PEP.
Wow.
Mhm.
Wow. And so being that you have had such a big impact, I am curious, how did you get into this space? I mean, why HIV/AIDS?
It was very serendipitous.
Was it?
Because I was recruited here to do teen pregnancy prevention back in 1984. And at that time, there was a lot of stigma. Well, there's still a lot of stigma associated with HIV, but there was a lot of hysteria about HIV spreading into the general population. So I was forced to learn about this new pandemic. And I also learned about, the populations that it was primarily affecting, primarily gay men. And so I was able to work with people who were living with HIV disease, bring them into classroom settings so that kids could personalize and put a face on it in terms of educating about them about their risk and what they could do to protect themselves from infection. And the rest is sort of history. And so, but again, I primarily have been focusing on HIV primary prevention for almost 40 something years, but then I also developed other community-based programs for the university.
Absolutely. Wonderful. Wonderful. And so I believe you mentioned that the HIV mobile testing project was 1991.
1991.
So how have you seen that evolve since then?
Well, it's been a model program where a lot of other entities and agencies have come to us to learn about what we've done because we've been very effective, where they could take our model and replicate it in their respective communities. Uh, and also during the course of implementing that program, we started doing primary health care. So we initially were just focusing on HIV screening of at-risk populations. Then in the mid-90s, we were approached by an organization called the Gay and Lesbian Adolescent Social Services Center, who had a major grant from the Robert Wood Johnson Foundation. And we partnered with them to actually go out in the evening when the mobile van would normally be parked with a whole medical team, a physician, physician assistant, medical assistant, and my counselors, and we targeted runaway and homeless youth in Hollywood. And we did that for about 4 years, and we saw over 5,000 kids in 4 years, unduplicated visits for those young people who came to the van who actually were seeking HIV screening. We established a seroprevalence rate of about 10% of the kids who were coming to seek medical services, primary healthcare services, were HIV positive. So we were able to refer those kids in for treatment. So we developed these skills and expertise over the years so that when COVID hit, we were literally able to hit the ground running because we had so much visibility out in the community. We had built up this trust and respect in the community. So when we segued into HIV mitigation, it was very easy for us to go out and to educate the community because we had been out in the community for many, many years. And so they knew that we were there to provide a service that was going to be saving lives.
Incredible. So you mentioned some of the homeless children and runaways and things like that. And I know that you also have another project called the Dolls of Hope Project. Are these young kids the inspiration for that program?
The kids who were inspiration for that program were primarily children from sub-Saharan Africa.
Okay.
So I had been able to do a lot of international travel back in the 90s, and many places that I went, especially in sub-Saharan Africa, where really, South Africa has been the epicenter for HIV since HIV came on the scene. And I was able to travel to orphanages and other facilities that were taking care of these kids who had been orphaned because either one or both of their parents had died from HIV related complications, And I noticed a lot of these children had no toys to play with. They were playing with rocks and sticks. And so in 1998, the theme for World AIDS Day was youth being a force for change. And because I collected dolls, black dolls, I said, well, why not make dolls for AIDS orphans? I was able to get a group of volunteers and some funding from a pharmaceutical company. And over a 6-month period with some master doll makers, we made about 600 dolls. I sent out letters to about 100 organizations with saying that we're making these dolls with the caveat that we will send them to you, but you need to send back to us dolls made by people either living with HIV disease or women who were engaged in income generating programs to support themselves. And surprisingly, we got about 30 dolls back. Majority of them came from Uganda. We had our World AIDS Day program in December of 1998 here on campus. About a couple hundred people came. And I thought that was going to be the end of the program. But what I found out was that by bringing the community together, and it was non-threatening in terms of doll making, people would come to a doll making class, but if you're saying you're having a class on HIV, because of the stigma, they might not show up.
Right.
But if you're saying you're making dolls, especially a lot of women, they would show up.
Yeah.
So the program now has been going strong for 25 years, and I've traveled the world with the project. I've done workshops at 3 international AIDS conferences, 2 in Durban, South Africa, 1 in Bangkok, Thailand. I've been able to interact with other doll makers from around the world. We've given out over 6,000 of these dolls since the program started in 1998. And most recently, through the, what's it called, the California Creative Corps, I was one of about 33 individuals who got a fellowship, a $100,000 fellowship to promote this art that I've been doing for 25 years. And so in the next 12 months, I'm going to be doing a series of Dolls of Hope workshops throughout South LA.
Yeah.
Because it's going to be underwritten through this fellowship that I received.
Wow. So I was going to ask, being that you're bringing in volunteers, you're bringing in these master craft makers, is it kind of an entry level? I guess I'm curious about the creation process of the dolls. Is it kind of entry level, easy to do?
It's very, very easy to do. I'm really good at it from having done it for so many years, but it takes about an hour to make a doll. I use the session to educate the public about HIV, and then we make dolls. Either they can keep their doll, because a lot of people bond and want to keep their doll, but then if they donate it to my program, when medical missions, either through the university or other nonprofits or churches, when they go out, they'll contact me maybe 3 or 4 months before they say they're going to travel internationally. They'll say, Cynthia, do you have any dolls that you can donate to us so that when we get to our destination, whether or not it's Haiti, South Africa, Uganda, that we'll have dolls to give kids. And that's how we've been able to disseminate so many dolls around the world. But it's a very easy process. Also, we found out initially when we started the program in 1998, we invited HIV positive women to come to the workshops along with non-infected women. And initially the women, because of the stigma associated with the disease, didn't want to disclose their status. But by the end of that 6-month period, the women had bonded. They were starting to share that they were living with HIV and AIDS. The non-infected women, totally accepted them and embraced them. And also we found out that making dolls is therapeutic. I found that out. It's very therapeutic. And so the children love to make the dolls. Adults love to make the dolls. I've had workshops with people as old as 94 and children as young as 4 or 5 making dolls along with their parents.
Wow. So you mentioned that some of the women were kind of concerned about sharing their status and just some of the stigmas. So I guess I'm curious, in your experience, what are some of those common misconceptions or stigmas associated with HIV and AIDS?
Well, we're 43, 44 years into the epidemic. And in my experience and working in the community, there's still a lot of education that needs to be done, number one. especially in communities of color. People still have a lot of misinformation in terms of how it's spread and the fact that it is no longer a death sentence. We have very effective treatment now, so that the sooner you know your status, get under the care of a specialist, get on these medications, that you can live a normal life. And I always talk about Magic Johnson. Magic Johnson has had it since 1991, and he's still living healthy because he caught it early. He got under the care of a doctor. He changed his diet. He's on those medications, and he's living a very rewarding and fulfilling life. But prior to these medications becoming available in the mid-90s, it was a death sentence, but it's no longer a death sentence. And so there's still a lot of education that needs to be done in school-based settings and in college settings, and in terms of young people knowing what the highest risk activities are, what they can do to protect themselves. And then you have, again, what is it? Pre-exposure prophylaxis. There's medication now for what they call high risk negative people that they can take. They can take a daily pill, or now they can even go in and take a shot every 2 months with some medication that is like a prophylaxis. And so that if you are exposed to HIV, it will protect you from seroconverting and from becoming positive. So there's a huge need to educate our community more about PrEP and the benefits of, if you are engaging in high risk activity, how it can protect you from acquiring HIV.
Yeah. And so being that there is a lot of education that still needs to be done, some people don't even want to get tested at all. So why is it so important, or why is it so crucial to identify individuals who are HIV positive and unaware, and what are the potential consequences of going undiagnosed?
Well, a couple of things.
Okay.
What is fueling the epidemic around the country and in LA County are undiagnosed people who don't know their status and who are probably out engaging in unprotected sex with their sex partners or drug using partners. So they are unknowingly exposing other people because they don't know their status. They don't know that they're HIV positive and that they could be exposing other people. The second thing is, again, it's no longer a death sentence. There's very, very effective treatment. You can live a normal life. Also, vertical transmission in terms of from mother to child. Country and in most Western nations, we've been able to eliminate vertical transmission. So women who are positive can have babies who are born uninfected and have a normal life. So it's very important that people have accurate information, that we dispel this misinformation that still might be floating around in our community, so that again, the earlier you know your status and get under the care of a physician where they can put you on these medications to control the virus replicating, the better your health outcomes are going to be. And there's because of the Ryan White Care Act and other federal funding, there's all type of support for people living with HIV disease in this country.
Yeah, absolutely. And so I am curious, being that HIV/AIDS is obviously a huge issue in the Black community, how can we effectively reach and engage those minority populations? For example, even in South Los Angeles, I guess I'm curious, what are some of the things that can be done?
Some of the things is you've got to train and educate people who are from the community, who know the community. You want to involve people living with HIV disease in any kind of educational outreach that you're conducting in the community. You want to identify the gatekeepers and individuals who people know and trust, so that those people can be educated and trained to spread the word, to dispel any kind of misinformation that people might be getting on social media or through word of mouth. And you definitely need to be having sexual health education at the middle school and high school level. A lot of people don't know that in this country there are over 20 million cases of STDs reported annually in this country. Over 20 million cases, over half of those cases are reported among people 25 and under. So there's still a need again, for people to have that basic education to know what the signs and symptoms of these diseases are, so that if they do have signs and symptoms, they know that they can go get treatment versus being in the dark, being ignorant, and just potentially spreading diseases to their sexual partners or to their friends.
Yeah, absolutely. And so I just really kind of want you to emphasize, or can you emphasize the importance of getting tested regularly?
Oh, yeah. Well, the CDC recommends anyone, I think 13 to 64,
Mhm.
that you should take a test, at least once a year. And for those who are sexually active, they recommend that you take a test at least, a couple of times a year to know your status. So,
Mhm.
yeah, it's very important. If you are sexually active, if you are actively using drugs and especially shooting drugs, you should be screened. And most of these screening services that are available through community clinics or through the health department are free. So you're not going to have to be paying out of pocket.
Mhm.
And you can know your status in a minute. Like there's a HIV rapid test, the finger prick test.
Mhm.
That's a 1 minute test where you can come into our mobile van. You could come into the freestanding clinic that we have open on 110th and Broadway, where we offer testing every Monday through Wednesday from 12 to 4, and find out within a minute your HIV status. Most of these tests are 99%, accurate. And so, yes, it's very important to test on a regular basis if you're sexually active.
Mhm.
Mhm.
Gotcha. And so, say someone doesn't want to get tested, or
Mhm.
they shy away from it. What are some of the signs and symptoms that they may notice, or can someone else notice those symptoms in someone else, or?
Well, normally when someone has been exposed to HIV, one of the first symptoms that you have is like you get this immune response, and some people might get a rash on their chest or swelling of their lymph nodes, and then those symptoms might go away and you might not have any symptoms again
Mm.
for many, many years. It depends upon, your immune system, because your immune system is going to be fighting the infection from the time you're initially infected. But once you start to develop AIDS, which is the end stage of the disease process, and you might have for 8 to 10 years before you develop, full-blown AIDS. Those symptoms, if you're not on medications, are pretty evident. Like years ago, uh, people with full-blown AIDS, you would have rapid weight loss. You would have what they call night sweats, where you wake up in the middle of the night and you'd have high fevers and you'd just be drenched. Some people would have something called uh, thrush, where they would have this white coating on their tongue. Some people would have diarrhea. Classically, what 20, 30 something years ago, people would develop this rare type of cancer called Kaposi sarcoma,
Mm.
where you would have these purple blotches, which represented a type of skin cancer, which normally, if somebody would have Kaposi sarcoma, it wouldn't be malignant, but with HIV, because your immune system is very, very weakened, it could be deadly. Also, people would develop pneumonia, pneumocystis carinii pneumonia.
Mhm.
But because more people are on these medications, and the way the medications work, they stop HIV from replicating. So if HIV can't replicate, it can't destroy your T cells. So your immune system is maintained. So you might not have any symptoms.
Mhm.
So you could never tell by looking at somebody whether or not they had HIV.
Mm.
Hardly, just
Yeah,
from
yeah,
looking at somebody.
absolutely.
So that's why you need to know other people's status. And if you're in a relationship, you just can't tell by looking at something. Well, they look clean. I hear that.
Right.
I hear that. Well, she looked clean. It's not about looking clean. It's about knowing what your status is. And the only way you can know that is by taking a test.
Mhm.
Yeah.
Mhm. So, okay, so it is really, really good to know your status. And so
Mhm.
once you learn your status, um, obviously we don't say that times have changed, and we don't say,
Mhm.
you know, now it's a death sentence. Now you can live, as you said,
Mhm.
several years,
Mhm.
a whole lifetime with the
Yes.
condition.
Mhm.
So, what are some of those latest advancements in HIV/AIDS treatment, and how can individuals in the Black communities get access to those treatments?
Okay. So there are very effective medications that are available now for people who are living with HIV disease. And again, 30 something 30 something years ago, 40 something years ago, people might be have had to have taken 30 or 40 pills in one day to stay alive, okay? And then a lot of the drugs, especially AZT, were pretty toxic, had a lot of side effects, where sometimes people didn't die from the HIV, but they died from the side effects of the drugs. But that's no longer the case. With all of the research that have taken place and new drugs that have come on the market, they're less toxic. And there are medications now where you only have to take one pill a day. There are some people who still don't like taking one pill a day. And within the last couple of years, they've come up with new medical treatments where you can go in and take a shot every 2 months. Okay? Take a shot, and that's it for your HIV infection.
Yeah.
So very effective treatments.
Good, very good. And so I'm curious, for those who are actually living with HIV/AIDS, what are some like the support services that they have, especially for people in the Black community?
Okay. Well, we have a program here called Drew Cares, which we've had for many, many years. And so we have all types of support programs for people living with HIV, where you have support groups with other people who are living with HIV that you come together. You have mental health support groups. You have where people can get help with housing, with transportation. Um, Entire families can get support, not just the individual. So it's not like people shouldn't be falling through the cracks, but they have to know, number one, first, that the resource exists. And they can't be afraid to seek the services if they feel that they're at risk and they need to know their status. That here, at least at our university, we have an HIV treatment clinic called the Oasis Clinic. It was one of the first clinics established probably in the country back in the early 80s by Dr. Wilbur Jordan. And that clinic has been running consecutively for almost 40 something years. So we have these treatment clinics, multiple treatment clinics, not only in South LA, but throughout all of LA County, where anyone living with HIV can go and get support, treatment, care, what have you.
Gotcha. So even outside of some of those support, treatment, care scenarios, I'm also curious about how patients can make sure that they're having these effective conversations with their doctors as well, in terms of treatment, risk factors, etc. So how can patients ensure that they are having those progressive conversations and taking control of their health?
Well,
the conversation.
You need to find a physician that you feel comfortable with, that you trust, that is open to you asking questions. And, there are, you can go online, there are resource directories, there are medical directories where you can find out who is specializing in HIV care. And even through support networks, you can find out who other people who are living with HIV disease, to find out what medical providers that they're seeing. Through the Drew Medical Society, that's an organization that's been around for decades, where people could find out what, say, minority or Black physicians within the Drew Medical Society are specializing in HIV treatment and care. You have the LA County Medical Association, where we just have had a Black physician elected as the president, Dr. Jerry Abraham. Then you have freestanding clinics that have been around for decades, where you can go and get medical treatment, such as the Oasis Clinic and other clinics in the community, county clinics, county-run clinics. And then through our churches, a lot of our churches have health ministries where and even some of the churches have HIV ministries that have been in place for decades, where again people can find out what medical providers are available that are providing this kind of treatment. We have the Association of Black Women Physicians that's been around for many, many years. Again, they would have physicians, Black female physicians within that association who are specializing in HIV care. So there's all kind of resources. You just got to ask, pick up the phone, call Charles Drew, call Drew Cares, and we can make referrals for you.
Yeah, absolutely. Just starting the conversation.
Yeah.
Starting the conversation.
Yeah.
Don't shy away from it. So I like to move back to, those who maybe are at higher risk or maybe predisposed or what are there any specific preventative or prevention methods that are recommended for Black individuals who are at higher risk, like maybe PrEP or any other?
Well, there's PrEP. Okay. Pre-exposure prophylaxis, which has been around since about 2012, and basically it's where there's medication where you take this pill once a day, and it serves as a prophylaxis so that you build up a therapeutic level of the drug in your system, so that if you are exposed to HIV, it can flush it out before you seroconvert. Then there's also a treatment regime called PEP, or post-exposure prophylaxis. This is for people who know that they've maybe been exposed to HIV, and they have like 3 days to go and get on this medication, on HIV medication, antiretroviral medication. You can go to an emergency room, you can go to a doctor, where they put you on this medication for 28 days, and they sort of like give you high doses of HIV medication, and it's about over 90% effective in terms of ensuring that you don't seroconvert and become HIV positive. But once you know you've been exposed, you have to get to that provider within 72 hours and get on that medication for it to be effective. With PrEP, it's about 99% effective. And again, once you go on that medication, as long as you're sexually active, you have to take it indefinitely. Okay. But again, it's 99% effective in protecting you from being exposed to HIV and seroconverting and becoming positive. Because once you become positive, then we can't reverse that. Right. You're going to be positive for life, which means you're going to have to get treatment for life. Yeah.
Yeah. And so, we were talking earlier about the importance of communicating and talking about it. And I think one of the things that kind of slows down that communication is what we said earlier about the stigmas and just different opinions within the Black community. So can you share some insight into how we can start destigmatizing HIV/AIDS in the Black community specifically, and just promoting more open conversations around the disease?
Well, that's what I've been involved in for 40-something years. So through the Doll Project, we've used that as a form of breaking the silence around HIV. You got to talk about it.
Yeah.
If you don't talk about it, how are you going to know that it even exists? And then focusing on the stigma that, you can't blame people because they've got an HIV infection. I mean, that nobody deserves that. And so you've got to talk about it. Could happen to anybody. It could happen to you. And so through your churches, through your sororities, through schools, through universities, we've got to get the word out that HIV is still an issue in our community, because when you look at the statistics, it's still African American and other people of color who have the highest seroprevalence rates, highest incidence rates, even after 40-something years. Our numbers are still disproportionate. There's still a health disparity because of all of these, what they call social determinants of health, and then you have institutionalized structural racism, biases, and what have you like that. And so a lot of people feel, well, you got effective treatment. It's no longer a death sentence, so I don't have to worry about it anymore. But that couldn't be further from the truth.
Right.
And so we still need to be in a position where we're talking about it, we're educating people about it, we're not feeling ashamed to talk about it, and that it's just a disease, and that there is effective treatment for the disease, and making sure that people have accurate information in terms of what they need to do to protect themselves from acquiring that disease. Okay. And that would be for any chronic disease. So HIV disease today is looked upon as a chronic manageable disease. Just how you have diabetes, hypertension, or any other health condition, and you go to your doctor on a regular basis and you get your workup, and then they adjust your medication as needed. Same thing happens with HIV. It's a chronic manageable disease. It's no longer a death sentence.
Yeah.
Yeah.
Nice. So while we are, kind of running low on time, so I do want to ask you one last question. And I think that this is obviously it's all important information, but especially this, while we are working on destigmatizing and educating, for those who are tested or have tested positive for HIV and they are struggling with talking to family, talking to their partner, what advice do you have for them on starting that conversation, educating their family, educating themselves? What advice do you have for
I think
diagnosed?
because the stigma still exists in our community and there's still misinformation floating around, they need to find somebody who they trust, who's not going to go and start spreading information about their condition in the community, and to start to share, what they might be experiencing, and seeing if that person might, be a support system for them. That's the first step, acknowledging that this is something that you're going to be living with for the rest of your life, and then finding individuals within your support network who you feel comfortable of sharing that information with, who's going to keep it confidential, who's not going to be out spreading information about you without your knowledge, and then finding other means of support out in the community, either through the medical community or through the church community or other social support networks within the community.
Absolutely. Absolutely. Well, thank you so much, Dr. Cynthia Davis. It has been a pleasure speaking with you. I think we can all agree that we have learned so much about HIV, about some of your amazing programs that you're involved in, and just we thank you. We thank you for all the work that you have done.
Thank you very much.
Absolutely. So we will be here for the rest of the day here at Charles Drew, again, speaking with the staff, the faculty who are sharing so much insight with us. And again, thank you. We'll be back in about an hour.